Imagine a burning sensation, a fiery discomfort creeping up from your stomach into your chest, sometimes even reaching your throat. It's more than just an occasional nuisance after a spicy meal. For millions, this is a daily reality, a persistent struggle known as gastroesophageal reflux disease, or GERD. This isn't just about heartburn, it's a chronic condition that can severely impact your quality of life, disrupt your sleep, and even lead to serious health complications if left unaddressed. We're talking about a condition that affects an estimated 20% of the adult population in Western countries, a staggering figure that highlights its prevalence and impact. In this deep dive, we'll unravel the mysteries of GERD, exploring its causes, symptoms, and the most effective modern treatments available today. Get ready to understand why your body might be turning against itself and what you can do about it. At its core, GERD is a disorder of the digestive system, specifically involving the esophagus and stomach. To truly grasp GERD, we must first understand the journey of food. After you chew and swallow, food travels down a muscular tube called the esophagus, which is approximately 25 to 30 centimeters long in adults. This tube acts like a superhighway, transporting food directly to your stomach. The stomach then churns and breaks down food with powerful acids and enzymes. The crucial point of failure in GERD often lies at the gateway between these two organs, a small but vital muscle that acts as a gatekeeper. Understanding this basic anatomy is the first step towards understanding why reflux occurs. The star player in preventing reflux is a specialized ring of muscle called the lower esophageal sphincter, or LES. Think of the LES as a one-way valve, a muscular gate that opens to allow food to enter the stomach and then promptly closes to prevent stomach contents, including potent stomach acid, from flowing back up into the esophagus. This elegant mechanism is designed to protect the delicate lining of the esophagus from the harsh, corrosive environment of the stomach. In a healthy individual, the LES maintains sufficient pressure to stay closed except during swallowing or belching. When this valve malfunctions, either weakening or relaxing inappropriately, the protective barrier is compromised, paving the way for GERD. So, what happens when the LES doesn't do its job properly? When it relaxes too frequently or becomes weakened, stomach acid, along with partially digested food and digestive enzymes, can reflux, or flow back, into the esophagus. Unlike the stomach, which has a protective lining specifically evolved to withstand strong acids, the esophageal lining is far more sensitive. This repeated exposure to acid irritates and inflames the esophageal tissue, leading to the characteristic burning sensation we call heartburn. This isn't just a fleeting discomfort. Over time, this chronic irritation can cause significant damage to the esophageal wall, leading to more severe symptoms and potential complications. While a malfunctioning LES is the primary culprit, several factors can contribute to its weakness or inappropriate relaxation. One common anatomical issue is a hiatal hernia. This occurs when a portion of the stomach pushes up through the diaphragm, the muscular wall that separates the chest and abdomen. When this happens, the diaphragm can no longer provide the necessary support to the LES, weakening its ability to keep stomach acid at bay. Imagine a rubber band that loses its tension. That's essentially what happens to the lace protective function when a hiatal hernia is present. The stomach's position is compromised, making reflux much more likely and frequent. Diet plays a monumental role in exacerbating GERD symptoms, even if it's not always the direct cause of the LES malfunction. Certain foods and beverages are notorious for either relaxing the LES or increasing stomach acid production. These include fatty and fried foods, which take longer to digest and can increase pressure on the stomach. Caffeine, alcohol, chocolate, peppermint, and even spicy foods are also common triggers. Acidic foods like citrus fruits and tomatoes can directly irritate an already inflamed esophagus. It's a complex interplay where what you eat can directly influence the frequency and severity of your reflux episodes, often turning mealtime into a source of dread. Lifestyle choices are equally powerful contributors to GERD. Obesity, for instance, significantly increases intra-abdominal pressure, pushing against the stomach and forcing acid upwards. Smoking is another major offender, as nicotine weakens the LES and also stimulates stomach acid production. Lying down immediately after eating allows gravity to work against you, making it easier for acid to flow back. Even tight clothing around the waist can put pressure on the abdomen, contributing to reflux. These seemingly minor habits can accumulate to create a perfect storm for persistent acid reflux, turning occasional heartburn into a chronic condition. Pregnancy is a common, albeit temporary, cause of GERD for many women. Hormonal changes during pregnancy, particularly increased progesterone levels, can relax smooth muscles throughout the body, including the LES. Additionally, as the fetus grows, the expanding uterus exerts increasing pressure on the stomach, physically pushing its contents upwards into the esophagus. This combination of hormonal relaxation and physical pressure often leads to significant heartburn and reflux symptoms, especially in the later stages of pregnancy. Thankfully, these symptoms usually resolve on their own after childbirth, but they can be quite uncomfortable while they last. Certain medications can also contribute to or worsen GERD symptoms. These include some anti-inflammatory drugs like NSAIDs, e.g., ibuprofen, certain blood pressure medications, calcium channel blockers, muscle relaxants, and even some asthma medications. These drugs can directly irritate the esophageal lining, relax the LES, or interfere with its normal function. It's crucial to review all your medications with your doctor if you're experiencing new or worsening reflux, as sometimes a simple adjustment to your prescription can make a significant difference in managing your symptoms. Beyond the classic heartburn, GERD presents with a wide array of symptoms, some of which might surprise you. Chronic cough is a common one, often mistakenly attributed to allergies or asthma. The refluxed acid can irritate the airways, triggering a persistent cough, especially at night. Laryngitis, characterized by hoarseness or a sore throat, can also be a symptom, as acid irritates the vocal cords. Even asthma-like symptoms, such as wheezing and shortness of breath, can be GERD-related, particularly if they worsen after meals or at night. These atypical symptoms often make diagnosis challenging, as they mimic other conditions. Regurgitation is another hallmark symptom of GERD, often described as a sour or bitter liquid or food particles coming back up into the throat or mouth. This is a direct consequence of the LES failing to contain stomach contents. The taste is distinctly unpleasant due to the stomach acid mixed in, and it can be particularly distressing, sometimes leading to a burning sensation in the throat and mouth. This can occur spontaneously, especially after eating, bending over, or lying down. It's a clear sign that the reflux is significant enough to overcome the esophageal defenses and reach higher up the digestive tract. Difficulty swallowing, medically known as dysphagia, can also be a symptom of chronic GERD. This occurs when the repeated exposure to stomach acid causes inflammation and scarring in the esophagus, leading to narrowing of the esophageal lumen. Food then has trouble passing through, creating a sensation of food getting stuck in the throat or chest. This symptom warrants immediate medical attention, as it can indicate more severe esophageal damage, such as strictures, which are abnormal narrowings, or even be a warning sign of more serious conditions developing in the esophagus. It's a red flag that should not be ignored. The constant irritation from acid can also lead to dental erosion. The corrosive nature of stomach acid can wear away tooth enamel, making teeth more sensitive and susceptible to cavities. This is particularly noticeable on the back surfaces of teeth. Bad breath, or halitosis, is another often overlooked symptom. The presence of stomach acid and partially digested food particles in the esophagus and throat can create an unpleasant odor, even with good oral hygiene. Both of these symptoms highlight the far-reaching impact of GERD beyond just the esophagus, affecting adjacent areas like the mouth and teeth. Diagnosing GERD typically begins with a thorough medical history and physical examination. Your doctor will ask about your symptoms, their frequency, severity, and any potential triggers. Often, a presumptive diagnosis can be made based solely on characteristic symptoms, especially if they respond to a trial of acid-reducing medications. However, for persistent or atypical symptoms, or to rule out more serious conditions, further diagnostic tests may be necessary. These tests provide objective evidence of reflux and assess the extent of any damage to the esophagus. A clear diagnosis is crucial for tailoring an effective treatment plan. One of the most common diagnostic tests is an upper endoscopy, also known as esophagogastroduodenoscopy or EGD. During this procedure, a thin, flexible tube with a camera on its end is inserted down the throat, allowing the doctor to visually inspect the lining of the esophagus, stomach, and the first part of the small intestine. The doctor can look for signs of inflammation, ulcers, strictures, or other abnormalities, and can also take biopsies of suspicious tissue for further examination. It's an invaluable tool for directly assessing the condition of the upper GI tract and identifying any damage caused by reflux. Esophageal pH monitoring is considered the gold standard for confirming GERD, especially in cases where symptoms are atypical or don't respond to conventional treatment. This test involves placing a small probe in the esophagus to measure acid exposure over a 24 to 48 hour period. Newer wireless capsule pH monitoring systems are also available, which are swallowed and transmit data wirelessly before being naturally passed. This provides objective data on how often and for how long stomach acid is refluxing into the esophagus, helping to correlate symptoms with acid exposure and confirming the diagnosis of GERD. Esophageal manometry measures the pressure and coordination of muscle contractions in the esophagus and the LES. This test can identify issues with esophageal motility, such as weak contractions or problems with the LES ability to relax and contract properly. While it doesn't directly measure acid reflux, it helps assess the overall function of the esophageal muscles, which can contribute to GERD. For example, if the LES pressure is consistently low, it strongly suggests a predisposition to reflux. This test is particularly useful in evaluating patients for potential surgical interventions. Barium swallow, or esophagram, is another imaging test where you drink a barium solution that coats the lining of your esophagus and stomach. X-rays are then taken as you swallow, allowing doctors to visualize the shape and function of the esophagus, identify any strictures, ulcers, or a hiatal hernia, and observe the movement of the barium. While it's less effective at detecting mild inflammation, it's excellent for structural abnormalities. It gives a functional overview of the swallowing process and the integrity of the upper digestive tract, complementing other diagnostic methods. The initial approach to managing GERD often involves significant lifestyle modifications. These are crucial and can be incredibly effective, sometimes even eliminating the need for medication. Eating smaller, more frequent meals can prevent the stomach from becoming overly full, reducing pressure on the LES. Avoiding trigger foods, those specific items that worsen your symptoms, is paramount. Maintaining a healthy weight helps reduce intra-abdominal pressure. Quitting smoking not only improves overall health but also strengthens the LES. These changes empower patients to take an active role in their own treatment, addressing the root causes where possible. Adjusting your eating habits extends beyond just what you eat. Timing is also critical. Avoiding meals within 2 to 3 hours of bedtime is highly recommended. Lying down with a full stomach allows gravity to work against the LES, increasing the likelihood of reflux. Elevating the head of your bed by 6 to 8 inches can also utilize gravity to your advantage, helping to keep stomach contents down during sleep. This is often achieved by placing blocks under the bedposts rather than just using extra pillows, which only elevate the head and neck, not the entire upper body, thereby being less effective. These simple adjustments can make a profound difference. Over-the-counter medications are often the first line of defense for mild to moderate GERD symptoms. Antacids, like Tums or Rolaids, provide quick, temporary relief by neutralizing stomach acid. They work almost immediately, but their effects are short-lived. H2 blockers, such as famotidine, pepsidase, or cimetidine, Tagamet HB, reduce acid production for a longer period, typically 6 to 12 hours. These are often taken before meals or at bedtime. While effective for occasional heartburn, consistent use should be discussed with a doctor, as they only address symptoms and not the underlying LES dysfunction. For more persistent or severe GERD, prescription medications become necessary. Proton pump inhibitors, or PPIs, are the most potent class of acid-reducing drugs. Medications like omeprazole, Prilosec, lansoprazole, Prevacid, and esomeprazole, Nexium, work by irreversibly blocking the proton pumps in the stomach cells that produce acid. This significantly reduces acid production, allowing the esophagus to heal. PPIs are highly effective for symptom control and healing esophageal damage, but they typically need to be taken consistently for several weeks or months, sometimes even longer, and require careful medical supervision. While PPIs are generally safe and effective, long-term use has been associated with some potential risks and side effects. These include an increased risk of certain infections, such as C. difficile, and nutrient deficiencies, particularly of vitamin B12 and magnesium. Some studies have also suggested a possible link to kidney disease and bone fractures, though these risks are often small and depend on individual factors. It's crucial for patients on long-term PPI therapy to regularly consult with their doctor to weigh the benefits against potential risks and to monitor for any adverse effects, ensuring the treatment remains appropriate. Prokinetics are another class of medications sometimes used for GERD, though less commonly than PPIs. These drugs, such as metoclopramide, Reglan, help strengthen the LES and speed up gastric emptying, meaning food moves out of the stomach faster. By improving motility, prokinetics can reduce the amount of time stomach contents are available to reflux into the esophagus. However, they are generally used cautiously due to potential side effects, particularly neurological ones, and are typically reserved for patients who don't respond well to other treatments or who have specific motility issues in addition to reflux. When lifestyle changes and medications fail to control severe GERD symptoms, or if there are complications like severe esophagitis, strictures, or Barrett's esophagus, surgical intervention may be considered. The primary goal of GERD surgery is to reinforce the LES, preventing reflux. It's a significant decision and usually reserved for carefully selected patients who meet specific criteria after a thorough evaluation by a gastroenterologist and a surgeon. Surgery isn't a cure-all, but it can provide lasting relief for many who have exhausted other options, offering a chance at a life free from chronic reflux. The most common surgical procedure for GERD is Nissen fundoplication. During this laparoscopic procedure, the upper part of the stomach, called the fundus, is wrapped around the lower esophagus and sewn into place. This creates an artificial valve that strengthens the LES, making it much harder for stomach acid to reflux. It's a highly effective procedure, with success rates often reported between 85 to 90% in terms of symptom resolution. Patients typically experience significant improvement in heartburn and regurgitation, often reducing or eliminating their need for acid-suppressing medications, leading to a much better quality of life. While Nissen fundoplication is effective, it does come with potential side effects. TIF is considered even less invasive than laparoscopic surgery and is often used for patients with smaller hiatal hernias or those who prefer a non-incisional approach. It's a promising development for those seeking effective reflux control without the significant recovery associated with more traditional surgeries. Complications of untreated GERD can be severe and life-altering. Chronic acid exposure can lead to esophagitis, which is severe inflammation, causing pain and difficulty swallowing. Over time, this inflammation can cause esophageal strictures, narrowings that make it extremely difficult for food to pass, often requiring endoscopic dilation. These mechanical obstructions are not just uncomfortable, they can significantly impair nutrition and overall well-being, highlighting the importance of early and effective management of GERD symptoms to prevent progressive damage. Perhaps the most concerning complication is Barrett's esophagus. This occurs when the normal squamous cells lining the esophagus are replaced by specialized columnar cells, similar to those found in the intestine. This cellular change is a direct result of chronic acid damage and is considered a precancerous condition. While only a small percentage of individuals with Barrett's esophagus will develop esophageal adenocarcinoma, it significantly increases the risk, by about 30 to 40 times. Regular endoscopic surveillance with biopsies is crucial for patients with Barrett's to monitor for any progression to dysplasia or cancer. Esophageal cancer, specifically adenocarcinoma, is the most serious long-term complication of GERD. It typically develops from Barrett's esophagus. The symptoms can be subtle in early stages but often include progressive difficulty swallowing, unexplained weight loss, and persistent chest pain. The prognosis for esophageal cancer can be poor, especially if diagnosed in advanced stages, underscoring the critical importance of effective GERD management, regular screening for Barrett's esophagus, and prompt investigation of any new or worsening symptoms. Prevention and early detection are key to improving outcomes. Managing GERD requires a holistic approach, often combining lifestyle changes, medication, and sometimes surgery. It's not a one-size-fits-all solution. What works for one person might not work for another. Consistent communication with your healthcare provider is paramount. They can help you identify triggers, adjust medications, monitor for complications, and guide you through treatment decisions. Taking an active role in your own care, understanding your body's signals, and adhering to your treatment plan are essential for long-term symptom control and preventing serious complications. Don't underestimate the power of informed patient participation. Beyond conventional medicine, some people explore complementary and alternative therapies for GERD, such as herbal remedies, acupuncture, or specific dietary supplements. While some individuals report relief, it's crucial to approach these therapies with caution and always discuss them with your doctor. Evidence for their effectiveness is often limited or anecdotal, and some remedies can interact with medications or even worsen GERD symptoms. A well-informed, evidence-based approach, integrating safe and proven methods, is always the best path forward to ensure both symptom relief and overall well-being. Always prioritize safety and efficacy. Living with GERD can be challenging, but it doesn't have to define your life. With proper diagnosis and a tailored treatment plan, most individuals can effectively manage their symptoms and prevent complications. Remember, that burning sensation, that sour taste, that persistent cough, these are not just minor inconveniences. They are signals from your body, urging you to pay attention. By understanding the causes, recognizing the symptoms, and exploring the modern treatment options available, you can take control of your digestive health and reclaim a life free from the constant burden of GERD. Don't suffer in silence, seek help and embark on your journey to relief. We hope this comprehensive overview has shed light on the complexities of gastroesophageal reflux disease. If you or someone you know experiences these symptoms, please consult a healthcare professional. Early intervention can make a significant difference. If you found this video informative, please give it a thumbs up, share it with others who might benefit, and subscribe to our channel for more in-depth health discussions. Your support helps us create more valuable content like this. Thank you for watching, and stay healthy.